Hi everyone, welcome to some of the last videos of our anatomy. Today we're going to cover the back muscles and also the front supporting muscles. So please turn to your book, use your book, on page 128, and it's going to start with the back muscles. Join me there. So the erector spinae, as we see in this beautiful example right here, they're the long muscles that kind of parallel the spinal cord. They're the strength of the spine, so to speak. This group has three sets of muscles running parallel to the vertebral column. The spinaeus run up the center of the back from one vertebral spinaeus process to the next. The longimus muscles are more lateral and run from the ilium to the vertebrae transverse process in the ribs. And the iliocostus are the most lateral and run from the one rib to the next. Contracting these muscles straightens the spine as in Tadasana. Contracting the laterally placed longimus and iliocostatalis produces lateral bending such as Utthita Trikonasana. Contracting one side or the other produces a rotational effect in twisting posture. The forward bends such as Uttasana and Karmasana stretch these muscles, so any kind of forward bend. When they reach full length, they tilt the pelvis forward by pulling on the back of the ilium, and this tilt draws the ischial tuberosities upward and stretches the hamstrings. And that's those ischial tuberosity, remember, are the sits bones, right? The base of the hamstrings. Back bends such as Urdhva Dhanurasana strengthen these muscles. So back bends like the full wheel help really strengthen all those parallel back muscles. Quadratus lumborum, one of my favorite muscles right here. I work on this a lot as a body worker. Probably my number one back muscle I work on when someone's having back problems or any kind of back pain in the lower hemisphere. And they're like, it's somewhere right back here. It's usually quadratus lumborum. Like ding, ding. All right, so quadratus lumborum, deep to the erector spinae lies the quadratus lumborum, a combination of 5 heads that form the square-shaped muscle. They have a common origin from the posterior iliac crest, driving into the foreparts and inserting on the transverse process of the lumbar vertebrae and the posterior section of rib 12, which is the last rib. Contracting the quadratus lumborum unilaterally flexes the trunk to the side in Utthita Trikonasana. Contracting both sides extends the lumbar spine in Urdhva Dhanurasana. So, and then you can also say that this muscle is called the hip hiker muscle, right? Because it's like the giddy up hip. It's like what kind of pulls the hip at a tilt. And if you think about hinging forward in the triangle pose, it's that movement right in there that gives that anatomically some just juice right there, right? The hip hiker. And also lifts your leg up to step into a tall truck or on a horse. You're using this muscle as well, or carrying a baby, right? A lot of moms, new moms, have this muscle contracted so tight when they hold a toddler or a little baby. When the pelvis is fixed, contracting the quadratus lumborum draws the ribcage downward, and this action can be used to deepen respiration. And that's another sign, like if the quadratus lumborum is tight and people will have trouble breathing, you're like, I can't get a full breath. Well, it's definitely one of those muscles that are contracting really tight. The quadratus lumborum and psoas major wrap around the lumbar spine to stabilize it, contracting the quadratus lumborum, psoas major, and rectus abdominis protects the lumbar spine and back bends. Origins are the interspinaeus, the spinous process of the vertebrae. The origin of the intertransverse vertebrae, the transverse process of the vertebra, and the origin of the iliocostalis is the sacrum and the ribs. The insertion of the interspinaeus is the spinaeus process of the vertebrae above. The transversari are the transverse process of the vertebrae above, and the iliocostas, the ribs above. And you can see how beautifully meticulous this are. These are the little, they weave in between the vertebrae. And then it's the long connecting pieces that run in between those, right? And then we have a more unilateral piece as the final, in iliocostalis. They attach the ribs to the back, right? So most of them move in between the vertebrae, and they're like this small, this tiny, super tiny. I once had my first acupuncturist, he said, the only way to stretch those are through body work and yoga. So remember that. So we're going to keep moving on to the back muscles. The nerve innervation is the lower thoracic and upper lumbar nerves, the chakra illuminated. Of course, what do you have here? The third and the fourth, right? So you have the solar plexus and the heart. And the origin of the quadratus lumborum is the medial iliac crest. And the insertion is the lower border of rib 12 and the transverse process of lumbar 1 through 4. So all that piece right here in the back, and I like to say that QLs run in the space between the ribs and the hips. So if you put your finger there and you feel a muscle, that's pretty much where it is. You kind of bend to the side, lateral bending, you'll feel it contract. All right. So the antagonists are the abs and the synergists are each other, the latissimus dorsi and the trapezius. All right, so the actions of the back muscles, they extend, they laterally flex, and they assist in rotating the vertebral column. The laterally placed erector spinae and the deeper quadratus lumborum contract to twist the back and lift the kidney region in poses such as Merichiasana 3. The erector spinae and quadratus lumborum lift and straighten the spine in Tadasana. An open chain contraction of the quadratus lumborum draws the ribs downward during respiration. And the synergy poses. The erector spinae muscles are the prime movers in the back bends Purvottanasana. So it's the Eastern intense stretch pose right here. It's like forward bend, but the reverse of it. Right, so you can see all the muscles highlighted on the back, just kind of filling it in. Such a beautiful pose. Combine contraction of the erector spinae with the synergists of the pose, including the quadriceps, the glutes, and the triceps. The combination stretches the rectus femoris, the iliopsoas, the rectus abdominis, pectoral major, the biceps, and the anterior neck muscles. Yes. All right, so now, one of my favorite, it looks like Batman, latissimus dorsi. My favorite back muscles, one of them. I love them all. The latissimus dorsi forms 2/3 of the superficial back muscles, originating from the posterior iliac crest, the sacrum, and the thoracolumbar fascia, rotating 180 degrees before inserting on the sides of the proximal humerus. So right around there. You could say like almost armpit level, that's where it attaches up. This twist increases the torque generated by contraction of the latissimus dorsi. This muscle draws the arm down and toward the body from the overhead position, right? So down and toward the body from the overhead position. Internally rotating the humerus, right? So you can also think of like a lat pull down, right? You're getting the action of like that whole back of the wing when you have something and you're just pulling it down, right? You're contracting that large muscle of the back. When the humerus is fixed, is in certain twists or upward dog, contraction of the latissimus dorsi draws the chest forward and opens it. Tightness limits overhead poses such as Virabhadrasana 1 or Vajradhanasana and Adho Mukha Svanasana. So you'll see people with tight lats, they can't really extend their arms, right? They'll be right here, like a warrior 1, and they can't swing them overhead because of the tightness right at the attachment, right? So we'll get them to open their lats. Latissimus dorsi, the origin is on the iliac crest, the thoracolumbar fascia, the spinaeus process of the sacral vertebrae 1 through 5, the lumbar vertebrae 1 through 5, I already said that, the thoracic vertebrae 7 through 12, the lower ribs, the 3 lower ribs, and the inferior angle of the scapula. I mean, it attaches a lot. And the insertion is the floor of the bicipital groove of the humerus. The nerve innervation, the thoracodorsal nerve, cervical nerve 6, 7, 8, in the 4th chakra. So right on here, right? The antagonists are the anterior deltoids, the pec major, and the long head of the biceps. The synergists are the posterior deltoids, which is the back of the deltoids, right? the pectoral major, the sternocostal portion extends the humerus and the long head of the triceps. And he, as always, on page 137 gives beautiful illustrated detail of what muscles it lights up. Latissimus dorsi, what does it do? Extends the arms from a flexed position, internally rotates and adducts the arm, ADDUX, so it draws toward the center line of the body. The latissimus dorsi contract, drawing the lower back upward and opening the chest as an Urdhva Mukha Svanasana, upward facing dog, right? Pulls the chest forward. And awakening this pose is a great one to do in down dog, right? The latissimus dorsi, in association with the pectoralis major, draws the body forward and through the arms during the transition from Adho Mukha Svanasana to Urdhva Mukha Svanasana. So upward facing dog to downward facing dog, all uses those lat muscles. And now we go to the shortest muscle, which is right above the lats, and it's a little bit on top, the trapezius, right? Your traps, right? Your traps, but this is the only part we feel, but actually it extends down pretty much middle back, right there. This is a broad triangular shaped muscle originating from the center of the back, extending the lower thoracic spine to the base of the skull, right? So all of these muscles in here. And inserting on the scapula and clavicle. Contraction of the lower fibers draws the scapula downward, and contraction of the upper fibers elevates and rotates the scapula upward. This action increases the contraction of the humeral head with the glenoid in the overhead movements, such as full arm balance. Contraction of the middle fibers adducts the scapula, assisting the rhomboids in opening the chest. Tightness of the middle fibers limits postures such as eagle pose, Gomukhasana B, and weakness in the lower and upper fibers limits arm balances such as Tolasana, Vrikshasana, respectively. Trapezius, all right, so the origin is the base of the skull, the posterior ligaments of the neck, the spinaeus process of the cervical vertebrae 2 through thoracic vertebrae 12. And that covers pretty much till like right below the scapula. The insertion is the posterior aspect of the lateral third of the clavicle, the medial margin of the acromion, and the superior spine of the scapula. The nerve innervation is accessory nerve, cranial nerve 11, cervical nerves 3 and 4, and of course, you guessed it, it's going to hit their fifth chakra, right, the throat. The antagonists are the upper fibers of the trapezius, the rhomboid major, the rhomboid minor, and the sternoclavicular mastoid. One of my favorite muscles right here of the neck, sternoclavicular mastoid, is SCM, right? It attaches on the sternum, right here, the sternum. This is your sternum. Clavicular, clavicle right here, right? Sits right here. And the mastoid. The mastoid is on the base of the jaw. So sternoclavicular, the mastoid, right? SCM, that whole muscle of the neck. Antagonist fibers. The lower fibers of the trapezius, the pectoralis minor, the pectoralis major, and the latissimus dorsi. All right, and the trapezius, the synergists, are the lower fibers, the pectoralis minor and the major, and the latissimus dorsi, and the upper fibers are the anterior lateral deltoids, rhomboids major and minor, and the sternoclavicular mastoid. And if you're like, what, all this? Just know that it's gonna take the front of the chest, the rhomboids, right, between the shoulder blades, the deltoids, and the neck, all to help move the trapezius, to aid in its system, because nothing is an island in the body, and it's all attached to something. Right, so when we listen to this, we're like, la, 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 la. You're just listening and try to familiarize yourself. When I'm like, well, where is the anterior and lateral deltoids? What does that mean? Anterior means the front, and the lateral means the side, right? So we can say it's the front and the middle deltoid. And there's 3 deltoids, the anterior, the lateral, and the posterior, right? There's 3 heads of the shoulder muscle, of like the cap of that deltoid, and you will see that and feel that. And if you just you can raise your arm to do the motion. A lot of times in massage school, that's what we did, is we just kind of did the motion like arms overhead. Well, what is engaging? You know, is my shoulder, do I feel the flexion in my shoulder? What's going on in my pec? Is my trap engaged? You know, what do I feel when I do that motion? And that's the easiest way for you to start to understand what's being ignited when you do an action in the body, right? And then you start to kind of piece it together and it all kind of makes sense. Oh, nothing is separate in this chain of movement or in here, right? Or if I've had nerve injury, or if someone I know has had a nerve injury or damage to this piece, then this might be affecting this piece. We're not expecting you to be anatomy experts, but just to get a little familiar more about your body and how you can apply it to other people's bodies. The action of the upper fibers of the trapezius contract in Urdhva Dhanurasana in full wheel pose, assisting the lift of the upper body, outwardly rotating the scapula and drawing the glenoid into the greater contact with the humeral head. Awakening these traps is a great one. The middle and the lower fibers of the trapeze contract in Tolasana, lifting the body and retracting the scapula inward and downward. Weakness in this muscle limits the ability to perform this pose. And these are it's like a full wheel and also like an arm balance lift up from a seated position. All right, so we're gonna talk about pectoralis minor and major. Please turn to page 144. This is a small three-headed muscle lying deep into the pectoral major, originating from the third, fourth, and fifth ribs, inserting on the choroid process of the scapula. The pectoralis minor draws the scapula downward and forward in open chain movements. Closed chain contraction of the pectoralis minor, while stabilizing the scapula posteriorly with the rhomboids, lifts the rib cage and respiration. So yeah, you need your pecs to breathe and to upright your spine and just help move everything into a beautiful fluid motion. And it definitely contracts breathing, respiration when these muscles are contracted and super duper tight. Pectoralis major presents as a large flat muscle forming the front of the chest. The larger sternocleidomastoid portion originates from the body of the sternum, and the smaller clavicular portion originates from the medial clavicle. Both portions combine to form one tendon, inserting in on the inside of the proximal humerus. Sequential closed-chain contraction of the pectoralis major draws the body forward as in moving from down dog to up dog. Both the portions abduct the humerus, as in Gomukhasana B, eagle. This is also a key muscle in push-up poses, such as Chaturanga Dandasana. The sternocostal portion stretches in overhead postures, such as Urdhva Mukha Dhanurasana, and tightness limits the depth of these poses. The origin of the pec major, we'll just call it pec major. The medial third of the clavicle, the anterior aspect of the sternum, right, the front of the sternum, and the upper six costal cartilages, the aponeurosis of the external oblique. All right, in the insertion of the pec major, lateral lip of the bicipital groove, the sternal fibers more proximal, the clavicular fibers insert more distally. And the origin of pec minor are the outer surfaces of ribs 2 and 5. The insertion of pec minor is the coracoid process of the scapula. I think it was a great, beautiful illustration of where they attach up. The antagonists to pec major are the millodeltoid, the supraspinaeus, the infraspinaeus, and the biceps long head. So those are muscles pertaining to the rotator cuff. The synergists to pec major, the latissimus dorsi and the triceps, the long head. The antagonists to pec minor, are the sternoclavicular the SCM, and the upper fibers of the trap, And the synergists to the pec minor are the rhomboid major, the rhomboid minor, and the latissimus dorsi. The nerve innervation chakra illuminated. Clavicular, the pec major is the clavicular portion, the lateral pectoral nerve, cervical nerves 5 through 7, sternal portion are the medial pectoral nerve, cervical nerves 8 through thoracic nerve 1. And for the pectoralis minor, the medial pectoral nerve, cervical nerves 8 through thoracic nerve 1. Chakra illuminated, 5th. So the 3rd. Okay, so pectoralis major and minor. In the action, ADD ducts the arm, internally rotates the arm. It flexes the arm from an extended position. It depresses the arm and shoulder, and the pec major and minor are stretched and awakened in Purvottanasana. Awakening the pecs, push up. So what's our push up? Chaturanga Dandasana. The pectoralis major and minor, in association with the serratus anterior, stabilize the upper body in this pose. Who doesn't like a chaturanga? Stretch and contracted. All right, so the upper arm stretches the lower fibers of the pec major. The pec minor contracts, drawing the scapula of the lower arm forward, and the rhomboids of the lower arm contract to stabilize the scapula, lifting the rib cage. Eccentrically contracting the upper arm, pec major facilitates the stretch, as seen here in Gomukhasana B, which is like a seated version of eagle. Actually cow pose, excuse me. So Gomukhasana, where the right hand goes behind the head and holds onto the left hand behind the back. And you can see all of this being ignited back there. All right, please join me for part 3, the shoulder girdle and the upper arms. There's actually not that much, but there is, but there's not. So we're gonna go to page 52 and review the shoulder muscles. Number 1, we have levator scapula. Number 2, anterior deltoid, the front deltoid. Then we have the lateral deltoid, the middle head of the shoulder cap. We have the biceps, the long head. Number 4, and number 5, the short head of the biceps. Number 6, the coracobrachialis. And then we have the subscapularis, number 7. Sub is under. Number 8, the serratus anterior. It's kind of close on the attached on the ribs, if you see that. And then we have number 9, the rhomboid minor. Number 10, the rhomboid major. And one sits on top of the other. Then we have supraspinaeus, number 11. That's usually the top part of the rotator cuff. Posterior deltoid, which means the back of the shoulder cap, is number 12. The triceps, the short head's number 13, the long head's number 13. The infraspinaeus is number 15. Teres minor, number 16. Teres major, number 17. If you kind of look in that general area, rotator cuff is all of this kind of circles the shoulder. All right, so it talks about the movements of the scapula. Abduction goes toward, it goes away from each other. Adduction goes toward each other. So anytime you hold the arms out, the rhomboids swing in, right? Anytime you draw the arms down, laterally down, you pull the shoulder blades away from each other. Abducts. All right, so the shoulder girdle and movement of the scapula. Upward rotation is like a great example of this, yes, of upside down tree, which is handstand pose. The downward rotation, right, of the scapula is a Tolasana, like a little mini pickup arm balance. And we have the movement of the upper arms. In flexion, you're in Urdhva Hastasana again, so upward facing tree. The extension is Purvottanasana, right? So we extend the shoulder blades. And the abduction in Virabhadrasana too. Again, like we pull the arms away from each other. The adduction, they come together in Vatyasana. The external rotation is in cow pose. And the internal rotation is in Parsvottanasana, where we can bring the hands behind the back and we forward bend. All right, now we're gonna go to the chapter 14 on the rhomboids, right? And we can see like they're located right between the shoulder blades. Everybody's like, oh, I have knots in my rhomboids. They always tell me that. The major and the minor rhomboids are flat rectangular muscles originating from the vertebral spinaeus process and ligament in the middle of the back and inserting into the medial border of the scapula. Contraction draws the scapula towards the midline and opens the chest. Poses such as Garudasana stretches the rhomboids. Contracting the rhomboids stabilizes the scapula and lifts the rib cage in association with the closed chain contraction of the pectoralis minor. The rhomboids are direct antagonists of the serratus anterior muscle, and the levator scapula assists in lifting and rotating the scapula. I also love that muscle levator. All right, so the origin of the rhomboids, they attach, number one, the major attaches on the spinaeus process of the thoracic vertebra 2 through 5, and then the supraspinaeus ligament. The minor, rhomboids minor, attach on the spinaeus process of the cervical vertebrae 7 and thoracic vertebrae 1, the lower ligamentum nucha, and the supraspinaeus ligament. The insertion of the major is on the medial border of the scapula, the spine, the medial border from scapular spine to inferior angle of the scapula. And the minor attach on the upper medial border of the scapula. Nerve innervation, chakra illuminated. The dorsal scapular nerve is cervical number 5, and of course it's the 5th chakra, the throat, right? The antagonists are the serratus anterior, as seen here through the scapula, the trapezius, the lower fibers, and the pectoralis major, the sternocostatular portion. And the synergists are the levator scapula and the trapezius. All right, rhomboids. The action is to stabilize and contract adducts and rotates the scapula downward, assists in opening the chest, and it contracting the rhomboids opens the chest in Mrityasana 1 and Virabhadrasana 2. You can see great, beautiful examples of this. Contracted and stretched. The rhomboids contract in Utthita Trikonasana, opposing the action of the serratus anterior, which also contracts. This action stabilizes the scapula and turns the chest. All right, so we're going to cover the serratus anterior, and then we will take a break to finish up the muscles of the arm. This serratus anterior, I love this muscle. It sits on the side of the ribs right here. And I keep learning more and more about it, and it's so fascinating. The multi-headed muscle forms the lateral part of the chest wall, giving a serrated appearance. It originates from the superior borders of the upper 9 ribs, inserting on the medial border of the scapula from the inside. Contracting this muscle draws the scapula forward and away from the midline, and relaxing it allows the scapula to be drawn toward the midline, opening the chest. Weakness in the serratus limits postures such as Chaturanga Dandasana, resulting in the winging of the scapula, in which the medial border lifts off the back. You can see that when someone's turned face down and they're lying on the floor, their scapula's kind of like wing out to the side. It looks kind of nutty, kind of just a little weird, because really the scapula kind of rotate on to the back, right? But it has that kind of like, and I guess this resembles the front. It's definitely upper thoracic imbalance in the front. So the origin of the serratus are the outer surfaces and superior borders of the ribs 1 through 9. The insertions are the costal aspect of the medial border of the scapula, and the nerve innervation, the chakra illuminated, of the long thoracic nerves, cervical nerves 5, 6, and 7, and it highlights the 5th chakra. The antagonists are the rhomboids, the major and the minor, and the trapezius, the middle fibers. The synergists are the pectoralis, and the action is stabilizes and protracts abducts the scapula, preventing the medial border from lifting or winging during the pushing movements. Assists scapular rotation. The serratus anterior contracts and prevents the winging of the scapula in Chaturanga Dandasana. That's a beautiful picture of what it does and where it is. The serratus anterior, contracted and stretched. The serratus anterior muscles contract in Utthita Trikonasana, Keep drawing the scapula away from the midline, extending the arms. This opposes the action of the rhomboids, which also contract in this pose. Adjusting the contraction of these opposing muscles assists in turning and opening the chest in this pose. How cool. All right, so we're gonna take a break and I'll see you in a minute.